a 16-year-old male that's coming in with a couple of problems. Today we're going to be managing blackheads on the nose and some milias. So I'm going to go ahead and start with the milias. I know that a lot of our viewers have asked about that, and so basically the way I manage milias is that I do use the 27.5 gauge needle, bevel up, and about a 45-degree angle, and I go on the base and I just make a small little incision, if you could see it. And the trick to using your Q-tips is really stretching that skin. You want to stretch that skin, and there it is. And I'm going to go back and double check that pore. Now, milia in Greek means little seed, and you could see it's a very hard little seed. Okay? So I'm going to go ahead and go back in here, and you can see it's empty. And it's very superficial. As you can see, there is no deep pore. It's just very much superficial. I'm going to go back and just double check. Yep, it's nice and clean. Okay. Again, at the base, stretch the skin. And there we go. There it is. Okay, there's the little seed right there. And double check. I've also been asked how many Q-tips do I go through? Probably about half a bag. And so usually it's about 50 Q-tips maybe, depending on how much areas I'm working. And you can see there's a little bit right there. I'm going to go back and get that. Go ahead and just kind of use the little Q-tip to make sure. And it's just the skin. Okay. All right, so then there's some here, smaller ones around the eyes. I'm going to go ahead and work with those. Again, stretch the skin. We go at the base. Make a little incision. And there it is. Okay. The trick is really stretching that skin. The other thing is I really recommend wood sticks. Cotton tip applicators, not the regular store-bought, because they tend to bend and you don't have that fortified strength that you need, I guess, to get that to hold in place so you don't slip. And there it is again. Okay. There we go. It's a little blackhead here. Go ahead and remove that. And go right here. Very small one there. Okay, there's another little blackhead there. Go. About 45-degree angle. Now this one's not Amelia. And I'm going to go at the base, okay? And I'm going to turn. And here we go. Put that pressure on the base and then turn it. There we go. Want to make sure we empty everything out. Again, stretch, angle. I do want to give a shout out to one of my colleagues, Josefa Reina. Thank you so much for your amazing video that you did the other day and mentioned me on it. And you're doing such a great job. Keep up the great work with the Q-tips. You're doing fabulous. And thank you for recognizing my work. But like I've said I've always said that you're just the queen when it comes to doing extractions, and so I'm learning so much from you also. Okay, so here's some blackheads here, and I'm gonna go ahead. I already probed them, and so I'm just gonna make sure that it's nice and deep enough so this comes out. So he's gonna have some good blackheads here for us to really see. And he's got some filament here. So blackheads, filament, and another blackhead. Okay. So let me switch out on the Q-tips. Okay, I'm going to turn his face just a little bit here so everybody can see it. And here we go. Okay, and here we go. Really at the base. There we go. Secret, again, it's really stretching that pore and getting right there underneath on that base. Go ahead and clean out really good. Okay, I'm going to go ahead and, again, just to make sure, I know there's more stuff in there, I'm just going to probe it a little bit more. There it is. Okay, here we go. Really want to make sure that I empty out that pore. So I'm going to go again at the base. Kind of a tricky little corner there. How are you holding up?
Good.
Awesome. Okay, I'm just kind of feeling that area there just to make sure. And yeah, everything is out. Okay, so now I'm going to work with this blackhead here and some filament on this side. Okay, stretch that skin and make a small little incision there. I'll start with a filament. On the sides here. Okay. Okay, so what I'm going to do now is I'm going to go ahead and go for this blackhead here. It's a tricky little corner. But again, I'm going to stretch that skin really good. And I'm going to go right at the base. And as you can see, starting to come out right at that base. And I know you probably can't see because my fingers are maybe in the way, but and there we go. Okay. Now I want to make sure that it's nice and empty, so I'll double check. Kind of always feel around that area to make sure. And it is. Okay. So we got, so far this is clean. Now I do want to go on the upper lip for him now. He's got a lot of blackheads here and you could see them. And this may be a little bit uncomfortable, okay? So I'll walk you through it. All right, does that sound okay? All right. So what I want to do is go ahead and make sure we stretch the skin. And if you look, there's 1, 2, 3, 4, 5, 6, 7 so far up on the upper lip. So this one's pretty much ready to come out. Okay. And it's got a little hair in there. Probing this one again. All right, I'm going to stretch the skin and I'm going to work at pushing all of that out, okay? There is a hair there, I see it. I'll go back and get that. That's this one. So I'm being a little bit more gentler because this area is very, very, very sensitive. Okay, and we're going to stretch that skin out again. I do want to make sure that's clean because if not, it's going to fill up again. So I'm going to go back and put a little bit more pressure, okay? Okay, turn him just a little bit this way. There's another one here. And stretch. Stretch. Okay, I'm going to start cleaning up this area and finishing up. Definitely you'll get a second part to this because I still have to work on this side. So far we've cleaned this area and it's doing really good. So thank you so much for joining us and for watching our videos. We truly appreciate your comments, your support. Please look us up on Facebook and Instagram. Again, I hope you guys have a wonderful day and we look forward to seeing you soon. Thank you so much for joining us today. I'm glad that you're with us. And so this is our third video. And anyway, we hope that you enjoy it. We look forward to your comments. Please join us on Facebook and Instagram and share with your friends and your family.
Okay, I'm just really double checking in here to make sure that it's got little tiny ones just. So I'm gonna double check in here. It's got some here that I want to take out. So I'm gonna use the needle to open that. There it goes. Right. All right. So I'm gonna check this area through here. It's gonna be a little uncomfortable, okay? And he's got an ingrown hair there too, you can see. You know, right? Sorry. You okay?
Mm-hmm.
So I'm going to get another one that you have right here. And you're gonna feel it too. The area is very sensitive. Okay, he's got two right here. Okay. I'm going to go ahead and do extractions here and see. It's probably more oils than anything here, but let's see what we find. It's a small one. Okay, I'm gonna check behind his ear and see. Okay, I'm gonna go ahead and go back to make sure it's thoroughly cleaned. He's got a couple back here. Still has. So we're gonna go ahead and keep cleaning. Okay, so I'm gonna check again, and you're just double check and feel through here to make sure again. Okay, I'm gonna go ahead and double check. Okay, that's cleaned out. That's good. All right, hopefully we can get this one. All right.
Can you see it?
Okay. Okay. a blackhead here that I want to get out. Let's see if we can. Hopefully, you can see it. My fingers are not in the way. This is the same one I was working on. Checked on the other one. Looks not good. Okay, I'm gonna try this with the Q-tip also, and that will do the. We'll use the comedone extractor because I do use them for the body, ears, and all that. So go one more time. So the comedone extractor, reason why I avoid it is because they can really feel it. This has got a cotton tip end, and here we go. See it coming out? Okay. Just making sure everything is nice and clean, and it is. A little bit more left in there, but overall, if you see, it's very clean. Okay. All right. Thank you so much for joining us. I truly appreciate your support. Look us up on Facebook, find us and like us, and tell your friends and family about us. Have a great day. Thanks. Okay, so guess who came into our office? Daryl. So we're so excited to see him. He did get the opportunity to see his dermatologist, and they did remove the whole cyst here with the sac, and he's healing very, very nicely. So he hadn't been here for several weeks because we were letting that heal, and so he's doing really good. Now what I'm going to do is go ahead and go back and clean up some areas. Remember, we talked about that because of his immune system being compromised, I can't do a lot of things that I want to do with his skin at this point, but he's doing great. They are going to fill up. And once he gets his health back in check, he's going to do fabulous. He's already doing fabulous, but he's going to do really good. So we're just going to go back in here and clean some areas up for him. So Daryl, talk to our viewers. How are you doing?
Doing fine.
Great. So what did your derm say?
That everything was healing up fine, and if I had any problems, to make sure that I come back.
Super. Glad to hear that. Well, we have missed you, and our viewers missed you. Doesn't matter what other videos I put up, they always ask about you. So thank you everyone for your support with Daryl, and we so appreciate that. Okay, so just gonna go through here and just keep cleaning those areas. Okay, go through here and so you can see it's really oily. So his body's still producing a lot of oil. And so as long as his body's still producing oils, we're going to be seeing him. Remember, he can't be on Accutane or any other medication. So
I've had viewers ask about that. Well, can he be on Accutane? It was a different scenario. Definitely, he's an amazing candidate for that. But at this point, no. So we just manage it this way. Okay, I'm going to go ahead and open up right through here. Daryl, can you tell us a little bit about what's the status with your kidney?
Oh, for the last few weeks, I've been testing for the VA hospital in Houston. So I have to do all of the tests over, all of the blood work, and it's been crazy for the last few weeks because I'm trying to get on the Houston list so I can be closer to home.
Oh, wonderful.
And that's going fine. We're almost at the end of the testing.
Yay. It's good to hear that. I'm glad.
It's been a long road.
It has been. I think the day that you go to surgery, we're going to close our place. We're all going to get in the car and we're going to go there with you.
Okay.
Yes.
It may be 2 o'clock in the morning.
That's okay. Can you breathe? Okay. Making sure. Several of my viewers have asked how much Q-tips do we go through. I wish I had stock in the company. We go through a lot of Q-tips, but I just prefer it so much more clean method, you know, and so yeah, we go through a lot of Q-tips. Right there, I'm gonna go through this little corner. Might be a little bit uncomfortable, okay?
Okay.
So you can see it's looking very nice and clean through here. The nose area is an area that will always fill up. So this is a little bit sensitive here.
Now, it's allergy season in Texas, so if you see a tear in Daryl's eyes, don't say I'm hurting him. No, I'm joking. Okay. So I'm really getting in these little areas through here. Okay, and we're going to go through these little corners in here. They accumulate oil in here too. So we're going to go ahead and clean that area. I'm going to turn you this way, Daryl. Thank you. Okay, I'm going to just check through here again. So you could see there's some blackheads here and through here, so I'm going to go ahead and do that there. Thanks, Daryl. You okay?
Mm-hmm.
All right. Right. And I'm going to kind of push this way, and you can see it, all the little blackheads there. So we're going to go, hopefully, can you see okay? Hopefully, my hands are not in the way. Again, just really just checking in here, make sure. Okay, and flesh mole, and that's cut off. Yeah, okay. A little pressure, Daryl, okay? They look like little freckles. Even though you have little freckles, Daryl, you know that, right?
Never noticed it.
No, yeah, you got a couple little freckles. Stretch in here and okay, I'm gonna go on this side here. Make sure it's clean. This side's not as bad.
Thank you so much for joining us. We look forward to seeing you again. We appreciate your support. Thank you for sharing our videos and telling your friends about us. Don't forget to look us up on Facebook. We look forward to seeing you next time. Have a great
We're on our second part of our video. And so we're removing the milias and the blackheads on his upper lip. Same blackheads around the nose and some filament around the corners of the nose area. So I'm going to go ahead and just open these. So here we go, stretching the skin out, and there we go. The only way that you can get a milia out is by actually opening it up. There's no other way. It's just not going to release. And it's a very hard little seed, and it has to be opened. Okay, stretch out the skin. There it is, right there. Okay. All right, so now we're going to go ahead and do the blackheads through here. And he's got two other blackheads right here. And he's got a couple of blackheads on his upper lip. There's one. There's another one here. And here it's a whitehead. Okay. Just opening that up. I'm going to stretch the skin. And there it is. All the pus is out.
Again from the base. Just put some pressure on there. Okay, so we're gonna move along this way here. Just double check that it's cleaned. Okay, another one here at the base, and here we go. On the blackheads, I'm going to stretch the skin. And I'm putting a little pressure on there, and that I'm noticing it's not where I want it to kind of be. So I'm going to, when I start doing the extractions, I can actually feel if they're going to release pretty good. And so I need to open them just a little bit more. Oh, my fingers are not too much in the way. Try it this way. Okay. Second pour here. Kind of a tricky corner, but you can see it's coming out. How are you holding up? Good. Oh, great. Okay. And there it is, and it's mixed in with a little bit of a hair, so you can see it. Okay. I'm gonna go back and just make sure it's nice and clean. I'm gonna use 4x4, my good friend's technique. And it's clean. Go back and check. Okay. All right, so now we're gonna go ahead and work on these.
see a tear. Is that hurting you a little bit?
I had to sneeze.
Oh, okay. Good comeback. That's a great comeback. Okay. Do you still need to sneeze? No? Okay. All right, so here we go. And so you guys can see. Still stuff in here, so we want to make sure that get it completely out. Okay. I still feel like there's something in there, so I'm going to go back just to double check. Yeah, there it is. Okay. And even though you don't see it with the naked eye, I always use your fingers to, just to feel. And you could feel whether there's any content in there. And it's gone. It's nice and clean now. So with this particular patient, I don't get to see him often at all. And so he's not on our wash, which is our 5% glycolic wash. That's what we usually send all our patients home with. What that does is that it does prime and prep the skin. So when they do come in here, the lesions themselves are so receptive to extractions. And so the top of his nose, it's not as receptive as I want him to be. And so I'm going to go ahead and clean some out. But what you could see, he's got a beautiful skin color. And what I don't want to do is put so much pressure that causes him to have, again, those little brown spots, those PIH. That's really my always has been my number one concern. And so I'm going to go back and wash it with a 20% wash. And that's going to help some. Go ahead and grab those right there. Blackhead there. Because of his age, he's going to be a little bit more prone to acne. But so far, I think he's going to escape having a lot of issues with acne, like true grade, 3 and 4, or even 2.
So as you can see here, he had a blemish at one time and now it's healing. I tend to always leave these little, dead skin cells here. So I'm going to just pull it out so you can see it. It's almost ready to come out. And I'm going to go ahead and there's one hair there that I want to pull out. And you could tell it just didn't take anything for me to pull it out. All right. We'd just like to thank everyone for joining us and truly appreciate you subscribing and telling your friends about us. Look us up on Facebook and Instagram. Again, thank you so much for your support.